Most of us wake up in the morning, walk into our kitchen, and start our day without thinking twice about what we are eating or drinking. We reach for something familiar, something comfortable, something we have been eating for years, maybe even decades. It feels safe. It feels normal. And yet, right there in that kitchen, there may be something that is quietly doing damage to one of the most important organs in your body, your kidneys. And the alarming part is that most people will never realize it until the damage has already been done. Now, I want to start by saying something that I truly believe, and it is the foundation of everything I talk about when it comes to health. The human body is extraordinary. It is not a fragile thing. It is not waiting to break down. In fact, your body was designed with layers of natural defense systems. Systems that fight inflammation, that repair damaged cells, that filter out harmful substances, and that protect your organs day and night. These systems are working right now, even as you sit and listen to this. And the science behind them is genuinely remarkable. But here is the important truth that too many people are never told: those defense systems have limits. When we expose our bodies to the wrong things, day after day, meal after meal, those defense systems get overwhelmed. They get worn down. And the organ that pays the highest price when that happens is very often the kidney. Because the kidney is your body's primary filtration system. It is working harder than almost any other organ to keep you clean, to keep your blood balanced, and to keep you alive. And when the kidneys start to struggle, the rest of your health begins to suffer too. Your blood pressure rises. Your fluid balance gets disrupted. Your bones begin to weaken. Your heart has to work harder. Your energy drops. These are not small inconveniences. These are serious, life-altering changes. And they often begin silently, with no warning, no pain, no obvious sign until the damage has already progressed. That is what makes kidney health one of the most misunderstood and neglected areas of wellness in America today. According to the National Kidney Foundation, more than 37 million Americans are living with chronic kidney disease right now. That is 1 in 7 adults. And shockingly, 9 out of 10 of them do not even know it. They have no diagnosis. They have no treatment. They are just going about their lives, eating the foods they always eat, drinking the drinks they always drink, while their kidneys slowly lose the ability to do what they were built to do. That is a staggering number, and it tells us something very important about where our attention needs to go. So today, I want to do something that I think is truly valuable. I want to talk to you about the specific dietary substance, something that is hiding in ordinary, everyday foods that most Americans eat every single day, that is contributing to this kidney health crisis in a way that the science is now making very clear. I want to explain what this substance is, what it actually does inside your body, why the kidneys are so vulnerable to it, and most importantly, what you can do about it. Because this is not a story about fear. This is a story about knowledge. And knowledge, combined with the right choices, is the most powerful medicine there is. Let me set the stage for you, because I think it helps to understand what your kidneys actually do before we talk about what threatens them. Imagine 2 small, bean-shaped organs, each about the size of your fist, sitting in your lower back on either side of your spine. Together, those 2 organs filter roughly 200 liters of blood every single day. Think about that for a moment. 200 liters. They remove waste products. They balance the minerals in your blood, things like sodium, potassium, and phosphorus. They regulate your fluid levels. They help control your blood pressure, and they even produce hormones that tell your bone marrow to make red blood cells. The kidneys are doing an enormous amount of work, quietly and constantly, every hour of every day of your life. And here is what is so important to understand. The kidneys do this filtering work through tiny structures called nephrons. Each kidney contains roughly 1 million nephrons. These are microscopic filtering units, and they are exquisitely sensitive to what passes through them. When the blood that flows into the kidneys is clean and balanced, the nephrons work beautifully. But when the blood is loaded with inflammatory compounds, excess minerals, or substances that the body was never designed to handle in large amounts, those nephrons begin to take on damage. And the devastating thing about nephron loss is that it is largely permanent. Once nephrons are damaged or destroyed, your body cannot simply grow new ones. You lose filtering capacity, and that lost capacity does not come back. This is why what you eat matters so profoundly for your kidneys. Every meal you consume, every drink you take in, every snack you reach for, all of it passes through your kidneys. All of it is filtered, processed, and either safely removed from the body or recirculated. Your kidneys see everything. And certain substances, one in particular that I am going to walk you through today, create a level of burden on the kidneys that, when consumed consistently over months and years, can push those filtering systems to the brink. Now, before I tell you what this substance is, I want to make something very clear because I think it is essential for the right mindset. I am not here to frighten you. I am not here to tell you that everything is dangerous and that you need to panic about every bite you eat. That is not how good health education works, and it is not how I approach anything. What I am here to do is share the science, the real peer-reviewed, clinically validated science, so that you can make informed decisions, so that you can understand your own body better, and so that you can take the kind of small, practical, sustainable steps that actually make a difference over time. Because here is what I know with complete confidence: when people understand why something matters, when they can see the biology clearly, when they understand what is actually happening inside their own body, they make better choices. They feel motivated, they feel empowered, and they see results. That is true whether you are 30 years old or 70 years old. Your body has a remarkable ability to heal, to recover, and to protect itself when you give it the right support. And today, I am going to show you exactly how to do that when it comes to your kidneys. So let us begin. The substance that kidney doctors across the country are increasingly concerned about, the one that is hiding in your kitchen, in your pantry, in the foods you buy at your grocery store every single week, is excess dietary sodium, salt. But not just any salt, and not in the way most people think about it. Because the salt problem in America is not simply about how much you are sprinkling on your food. It goes much, much deeper than that. And understanding the full picture of how sodium affects your kidneys at a cellular and biological level is what will truly change how you see your daily food choices. Sodium is an essential mineral. Your body needs it. It plays a critical role in fluid balance, nerve signaling, and muscle function. That is true. But the human body evolved over hundreds of thousands of years in an environment where sodium was relatively scarce. Our ancient ancestors consumed an estimated 500 to 1,000 milligrams of sodium per day. Today, the average American consumes more than 3,400 milligrams of sodium every single day. And many people consume far more than that. We are eating salt at levels that are anywhere from 3 to 7 times what our biology was ever designed to handle. And the kidneys, which are responsible for managing every single milligram of sodium that enters your body, are paying the price. But here is what makes this story even more urgent. The vast majority of the sodium that Americans consume is not coming from the salt shaker. It is not coming from a conscious choice to add more seasoning to a home-cooked meal. It is hidden. It is processed into the foods that line the shelves of every grocery store, every fast food restaurant, every vending machine, every convenience store across the country. It is in bread, it is in soup, it is in salad dressings, canned vegetables, frozen meals, breakfast cereals, deli meats, cheeses, crackers, condiments, and hundreds of other foods that most people would never suspect. The food industry has been adding sodium to processed foods for decades, not just for flavor, but because sodium acts as a preservative, extending shelf life and reducing manufacturing costs. And this hidden sodium is moving through your kidneys right now, quietly putting stress on those 1 million nephrons that are working so hard to keep you healthy. Over the next sections of this video, I am going to walk you through exactly what happens inside your kidneys and your blood vessels when sodium levels stay too high for too long. I am going to show you the science of how inflammation unfolds, how blood pressure rises, how the filtration membranes in your kidneys begin to wear down, and how this connects to chronic kidney disease, heart disease, and overall aging of the body. And then I am going to give you the practical, science-based tools, the foods, the habits, the lifestyle choices that can help protect your kidneys, reduce your sodium burden, and support your body's extraordinary natural defense systems. This is knowledge that can genuinely change the course of your health. So stay with me, because what comes next is going to be very important. Now that we understand what is at stake, and why your kidneys deserve far more attention than most of us have been giving them, I want to take you inside the body. I want to show you the biology, because when you see what is actually happening at a cellular level, when sodium levels stay too high for too long, everything changes. The way you look at a bag of chips, a can of soup, a restaurant meal, all of it starts to look a little different. And that shift in perspective is what leads to real, lasting change. Let us start with what happens the moment you consume a high sodium food. Imagine you sit down to a bowl of canned chicken noodle soup. A single standard serving of many popular canned soups contains anywhere from 800 to over 1,000 milligrams of sodium. That is already close to the recommended daily limit that many kidney health experts suggest for people trying to protect their kidney function. In one bowl of soup. And many people eat the whole can, which doubles those numbers instantly. The moment that sodium-rich food enters your digestive system, the sodium is absorbed into your bloodstream relatively quickly. Your blood now has a higher concentration of sodium than it had before. And your body detects this immediately because your body is extraordinarily sensitive to changes in blood chemistry. One of the first things that happens is that you feel thirsty. That thirst signal is not random. It is your body's way of telling you to bring in more water to dilute that excess sodium and restore balance. This is part of a process called osmoregulation, and your kidneys are the conductors of that entire process. So the kidneys receive this sodium-rich blood and get to work. They try to filter out the excess sodium and excrete it in your urine. But here is the problem. When you are regularly consuming sodium at the levels that the average American does, 3,400 milligrams per day or more, the kidneys are under constant, unrelenting pressure to manage that load. They are not just doing this once in a while. They are doing it every meal, every snack, every drink, day after day, week after week, year after year. And over time, this persistent sodium overload triggers a cascade of biological responses that are genuinely damaging. The first is elevated blood pressure or hypertension. When there is too much sodium in your bloodstream, your body retains more water to dilute it, which increases the volume of fluid moving through your blood vessels. More fluid volume means more pressure on the walls of those blood vessels. That is high blood pressure, and it is one of the single most destructive forces for kidney health that we know of. High blood pressure damages the delicate, tiny blood vessels inside the kidneys, the ones that feed those nephrons and keep them functioning. When those blood vessels are damaged, the nephrons they supply begin to struggle. They start to lose their filtering efficiency. And as I mentioned earlier, that lost efficiency does not come back. Here is something that I think is really important for people to understand, because it surprises many of my patients when I explain it. High blood pressure and kidney disease exist in a vicious cycle. High blood pressure damages the kidneys, but damaged kidneys also make high blood pressure worse because the kidneys play a central role in regulating blood pressure through the production of hormones like renin. When the kidneys are struggling, their ability to regulate blood pressure is compromised, which leads to even higher blood pressure, which causes even more kidney damage. It is a loop, and once you are caught in it, breaking out becomes harder and harder over time. This is why prevention and early action matters so enormously. But the damage that excess sodium causes is not limited to blood pressure. There is a second major pathway, and it involves inflammation. Chronic inflammation is one of the most powerful drivers of disease in the modern world. It is the underlying process behind heart disease, diabetes, cancer, Alzheimer's, and yes, kidney disease. And recent research has revealed something profoundly important. High dietary sodium intake is a significant driver of chronic inflammation. A study published in the Journal of Clinical Investigation found that high salt conditions activate specific immune cells. In particular, a type called the 17 cells in ways that promote inflammatory responses throughout the body. The kidneys, which are in constant contact with whatever is circulating in your blood, are directly exposed to these inflammatory signals. And when inflammation becomes chronic in the kidney tissue, it begins to cause what is known as fibrosis, a process where healthy, functional tissue is gradually replaced by scar tissue. Scar tissue cannot filter blood. Scar tissue cannot regulate your sodium or your fluid balance. It just sits there, taking up space where healthy nephrons used to be. This process of renal fibrosis is one of the central mechanisms by which chronic kidney disease develops and progresses. And what is so alarming about it is how quiet it is. You cannot feel fibrosis happening inside your kidneys. There is no pain signal, no warning alarm. Your kidneys can lose 30 or even 40% of their filtering function before you begin to notice any symptoms at all. By the time someone starts feeling tired and swollen, or notices that their urine looks different, or starts having uncontrolled high blood pressure, often the damage is already quite advanced. This is why chronic kidney disease is so often called a silent disease, and it is why understanding the dietary root causes, like chronic excess sodium, is so critical for prevention. Now I want to talk about another mechanism that connects sodium to kidney damage, and this one involves something called oxidative stress. Your body has natural antioxidant systems that neutralize harmful molecules called free radicals. Free radicals are byproducts of normal metabolism, and in small amounts, they are not a problem. Your body's antioxidant defenses handle them efficiently. But when those antioxidant systems are overwhelmed, free radicals accumulate. And one of the key triggers of that oxidative overwhelm is excess sodium. Research has shown that high sodium conditions in the body increase the production of free radicals within the kidney tissue itself, and simultaneously reduce the activity of the enzymes that neutralize them. This creates an environment of oxidative stress directly inside the kidneys. Damage at the cellular level, happening quietly, over time, eroding the integrity of those precious nephron structures. There is also the matter of the glomerular filtration membrane, the actual filtration barrier inside each nephron. Think of this membrane as a very precise sieve with tiny pores that allow water and small waste molecules to pass through while keeping larger, essential molecules like proteins inside your bloodstream where they belong. When sodium-related hypertension and inflammation damage this membrane, those tiny pores become abnormal. The filtration barrier starts to leak. Proteins, particularly a protein called albumin, begin to pass through into the urine, which they are never supposed to do. Doctors can detect this with a urine test that measures protein levels, and the presence of protein in the urine, known as proteinuria, is one of the early warning signs of kidney damage. It tells us that the filtration barrier has been compromised. And once proteinuria appears, the risk of progressive kidney damage increases significantly. I also want to address something that many people do not realize about sodium and kidney stones. Kidney stones are an incredibly common and incredibly painful condition, one that sends hundreds of thousands of Americans to the emergency room every single year. And one of the most well-established risk factors for calcium oxalate kidney stones, the most common type, is high dietary sodium intake. Here is why, when you consume excess sodium, your kidneys excrete more of it in the urine. But they also excrete more calcium along with it. This is a direct relationship that has been validated in multiple clinical studies. When calcium levels in the urine are elevated, and particularly when combined with other factors like low fluid intake and high oxalate foods, calcium can crystallize and form stones. Reducing dietary sodium is one of the most effective interventions that kidney specialists recommend for preventing recurrent kidney stones. More effective, in fact, than reducing dietary calcium itself, which is a common misconception. Now let us talk about something equally important, the role that processed foods specifically play in this problem. Because I want to be very clear, The sodium crisis in America is not primarily a cooking problem. It is a food manufacturing problem. When researchers analyze where sodium in the American diet actually comes from, they find that somewhere between 70 and 80% of total sodium intake comes from processed, packaged, and restaurant foods, not from the salt shaker at home. Foods like bread and rolls, which most people never think of as salty, are consistently among the top contributors to sodium intake in the United States. Then you have cold cuts and cured meats, pizza, soups, sandwiches, cheese, and savory snacks. These foods are engineered to contain sodium at levels that the food industry knows will keep consumers coming back. Because sodium, in combination with fat and simple carbohydrates, activates pleasure centers in the brain that make food feel more satisfying and more addictive. It is not an accident that processed food is so hard to stop eating. It is by design. And here is the tragic intersection. The people who are most likely to be eating a diet dominated by processed, high-sodium foods are also the people who are most likely to be at risk for kidney disease. People who are managing diabetes, because high blood sugar and high sodium together are a particularly destructive combination for the kidneys. People who are managing obesity, which is independently associated with kidney stress. People who are older, because kidney function naturally declines somewhat with age, and the kidneys of a 60 or 70-year-old have less reserve capacity to handle a chronically high sodium load. People living in food deserts, where fresh, whole foods are simply not accessible. The sodium crisis is not just a dietary issue. It is woven into the fabric of American food culture and food access. And understanding that is the first step toward doing something about it. I also want to briefly address the connection between sodium intake and the gut microbiome, because this is an area of emerging research that I find genuinely fascinating. Your gut is home to trillions of microorganisms, bacteria, viruses, and fungi that collectively make up what we call the gut microbiome. This microbiome is now understood to influence virtually every aspect of health, from immune function to mood to metabolism. And recent studies, including research published in Nature, have shown that high-salt diets reduce the diversity and abundance of beneficial gut bacteria, particularly a species called lactobacillus. When lactobacillus populations decline, it contributes to higher levels of inflammatory signaling throughout the body, which then feeds right back into the cycle of inflammation and kidney stress that we have been talking about. Your gut and your kidneys are more connected than most people realize, and what you eat affects both simultaneously. I know that is a lot of biology to take in, and I appreciate your patience in walking through all of it with me. But I share all of this with a very specific purpose, because I believe that when you understand the full picture, when you see the real, concrete mechanisms by which excess sodium damages your kidneys, raises your blood pressure, promotes inflammation, causes oxidative stress, disrupts your gut microbiome, and contributes to stone formation, you are far better equipped to make choices that protect you. You are not just following a rule someone told you. You understand why the rule exists. You can see the biology. And that understanding is power. In the next part of this video, I am going to take all of that knowledge and turn it into practical, actionable steps. The foods, the habits, and the lifestyle changes that can genuinely help your kidneys heal and protect themselves over time. We have spent considerable time understanding sodium, and rightly so. It is the most widespread and most underappreciated dietary threat to kidney health in America today. But I want to make sure we look at this issue completely, because the kidneys are not under assault from just one source. There are several other dietary factors and lifestyle patterns that compound the sodium problem significantly, and understanding all of them together gives you a complete picture of what your kidneys are up against, and more importantly, what you can do to protect them. Let us start with sugar, specifically in the form of fructose, which is the type of sugar most commonly added to processed foods and soft drinks in the form of high fructose corn syrup. Fructose is metabolized differently from glucose, and its effects on the kidneys are specifically concerning. When you consume large amounts of fructose, as millions of Americans do every day through sodas, sweetened beverages, fruit juices, candy, and processed snack foods. The liver processes it and converts it into uric acid as a byproduct. Uric acid is a waste product that the kidneys must then filter and excrete. But when uric acid levels in the blood become too high, a condition called hyperuricemia, it creates two serious problems for the kidneys. First, uric acid can crystallize inside the kidney tubules, contributing to a specific type of kidney stone. Second, and perhaps more seriously, elevated uric acid levels are now understood to directly damage the blood vessels that supply the kidneys, contributing to hypertension and nephron loss through many of the same mechanisms we discussed with sodium. Research published in the American Journal of Physiology has demonstrated that high fructose intake in animal models causes changes in kidney function that closely mimic early chronic kidney disease, including increased inflammation in kidney tissue, elevated blood pressure, and reduced filtering efficiency. And while human studies are more complex, the epidemiological data is consistent. Populations with higher sugar, sweetened beverage consumption have higher rates of kidney disease, kidney stones, and gout, which is itself a condition caused by uric acid excess. This is why kidney specialists are increasingly paying attention not just to sodium, but to the total burden of sweetened, processed foods in their patients' diets. Now let us talk about protein, because this is an area where there is a lot of confusion and, frankly, a lot of well-meaning but misleading advice circulating in popular culture. The high-protein diet trend, eating very large amounts of animal protein every day in the belief that it supports muscle building, weight loss, or metabolic health, has some significant implications for kidney function that deserve a careful, balanced discussion. When you eat protein, your body breaks it down into amino acids, and the nitrogen component of those amino acids is converted into urea, which must be filtered by the kidneys and excreted in the urine. The more protein you eat, the more urea your kidneys must process. For people with healthy kidneys and moderate protein intake, this is not a major concern. But for people who already have some degree of reduced kidney function, which, as we discussed, may include millions of people who do not know it yet, a chronically very high protein intake can accelerate kidney decline by increasing what is called glomerular hyperfiltration. Glomerular hyperfiltration is a state where the kidneys are working at a higher than normal intensity to clear the excess waste load. In the short term, this seems like efficiency, but in the long term, it causes wear and tear on the glomeruli, those critical filtration units, that accelerates their decline. It is similar to running a car engine at high RPM constantly. The engine might seem to be performing well, but the internal wear accumulates faster than it would at normal operating speeds. The clinical evidence for this comes from multiple sources, including a review published in the Journal of the American Society of Nephrology, which found that in individuals with existing kidney disease, high protein intake was associated with faster progression of disease. For people with healthy kidneys, the risk is lower, but it is still worth being mindful of protein sources and quantities, particularly when animal proteins are the primary source, since red and processed meats carry additional burdens of saturated fat, advanced glycation end products, and phosphorus, which we will discuss in a moment. Phosphorus is another mineral that the kidneys must manage carefully, and it is one that many people have simply never heard of in the context of kidney health. Phosphorus is essential to the body. It is part of the structure of bones and teeth, and it plays a role in energy production at the cellular level. But when the kidneys are struggling to maintain filtering efficiency, phosphorus levels in the blood can start to rise. High phosphorus levels in the blood trigger a whole cascade of hormonal and metabolic changes that accelerate kidney disease, damage blood vessels, weaken bones, and increase the risk of cardiovascular events. This is why in people with chronic kidney disease, managing dietary phosphorus becomes increasingly critical as the disease progresses. The most concerning dietary source of phosphorus is not natural, whole foods. Phosphorus from foods like legumes, nuts, and whole grains is not absorbed as efficiently by the body. The most bioavailable and therefore most harmful source of phosphorus is phosphate additives. The synthetic phosphates that food manufacturers add to processed meats, fast foods, carbonated beverages, cheese products, and packaged baked goods. These additives are absorbed at a rate of nearly 100%, compared to the roughly 40 to 60% absorption from natural food sources. And they are everywhere in the American processed food supply. They are used as preservatives to enhance flavor, to improve texture, and to maintain the color of meats. Most food labels do not specifically call out phosphate additives as a health concern, so most consumers have no idea how much they are consuming. For people with compromised kidney function, this hidden phosphorus load is a serious and underappreciated threat. Alcohol is another substance that places a significant burden on the kidneys, and its effects are multifaceted. Alcohol is a diuretic. It suppresses the hormone vasopressin, which tells the kidneys to retain water. When vasopressin is suppressed, the kidneys begin excreting water at a faster rate, which leads to dehydration. Dehydration concentrates the waste products in the urine and reduces blood flow to the kidneys, both of which are harmful over time. Chronic alcohol consumption is also associated with elevated blood pressure, another mechanism through which it damages kidney function. And alcohol raises uric acid levels, linking it to both kidney stones and gout. I am not saying that an occasional glass of wine or beer causes kidney damage, but chronic, heavy alcohol use is clearly and consistently associated with higher rates of kidney disease. And even moderate, regular drinking is worth being mindful of if you are already at risk. Nonsteroidal anti-inflammatory drugs, commonly known as NSAIDs, things like ibuprofen and naproxen, are another frequently overlooked threat to kidney health. These medications are available over the counter, they are inexpensive, and millions of Americans take them routinely for headaches, back pain, joint pain, and general discomfort. But NSAIDs work by blocking a class of enzymes called cyclooxygenases, which produce prostaglandins. And here is the problem. Prostaglandins play an important role in maintaining blood flow to the kidneys, particularly in situations where blood pressure is low or blood flow is otherwise compromised. When NSAID use reduces prostaglandin activity, it can reduce blood flow to the kidneys in ways that, with regular use, cause cumulative damage. Chronic NSAID use is a recognized cause of a condition called analgesic nephropathy, kidney damage caused specifically by pain medication. For people who take these medications daily or near daily for chronic pain management, the kidney implications deserve a serious conversation with their doctor. Dehydration itself, simply not drinking enough water, is a contributor to kidney stress that is both extremely common and extremely easy to address. The kidneys rely on adequate water intake to flush waste products out of the body effectively. When you are chronically dehydrated, the urine becomes more concentrated, the waste products are more likely to crystallize, and the kidneys are working in a less than optimal environment. Research has consistently shown that adequate hydration reduces the risk of kidney stones, slows the progression of chronic kidney disease, and supports overall kidney function. And while individual hydration needs vary based on body size, activity level, and climate, a general guideline that many kidney specialists recommend is aiming for urine that is pale yellow rather than dark yellow or amber. Dark urine is your body telling you that your kidneys are not getting the water they need to do their job well. I also want to touch on the role of chronic stress, because this is something that most kidney health conversations miss entirely. Stress activates the body's sympathetic nervous system, the fight or flight response, which causes the adrenal glands to release cortisol and adrenaline. These hormones temporarily raise blood pressure, constrict blood vessels, and redirect blood flow away from the digestive and filtering organs toward the muscles and the heart. In an acute emergency, this is a brilliant survival mechanism. But when stress is chronic, when you are living in a state of persistent worry, anxiety, overwork, or emotional strain, that sympathetic nervous system activation becomes chronic too. And the kidneys, which require good blood flow to function optimally, are affected by that chronic constriction and chronic blood pressure elevation in ways that accumulate over time. Managing stress is not just a mental health recommendation, it is a kidney health recommendation. Sleep is another area that has direct implications for kidney function. Research published in the Clinical Journal of the American Society of Nephrology found that short sleep duration, consistently getting less than 6 hours of sleep per night, was associated with faster decline in kidney function over time. This is believed to be related to the fact that blood pressure follows a natural dip during sleep, what doctors call nocturnal dipping. And this dip appears to be important for allowing the kidneys to recover from the demands of the day. When sleep is consistently disrupted or insufficient, that nocturnal blood pressure recovery does not happen normally, and the kidneys are under elevated pressure even during the hours when they should be resting. Sleep, it turns out, is one of the most underrated interventions for kidney protection, and it costs nothing. Physical inactivity is also closely tied to kidney health risk. A sedentary lifestyle is associated with higher rates of obesity, diabetes, and hypertension, all of which are major risk factors for chronic kidney disease. Exercise, on the other hand, improves blood flow, reduces inflammation, helps maintain healthy blood pressure, supports weight management, and improves insulin sensitivity, which protects against the blood sugar dysregulation that is so damaging to the kidney's filtration membranes. Even moderate exercise, a 30-minute walk 5 days per week, has been shown in clinical research to meaningfully reduce kidney disease risk factors. You do not need to run marathons to protect your kidneys. You just need to move your body regularly. And finally, I want to mention smoking because its effects on the kidneys are severe and well documented. The chemicals in cigarette smoke directly damage blood vessel walls, reduce blood flow to the kidneys, increase blood pressure, and promote inflammation and oxidative stress. All of the same mechanisms that excess sodium and other dietary factors use to harm the kidneys. People who smoke are significantly more likely to develop chronic kidney disease than non-smokers. And among people who already have kidney disease, smoking dramatically accelerates its progression. If you are a smoker and you are watching this video because you care about your health, quitting smoking may be the single most impactful step you can take for your kidneys, your heart, your lungs, and your overall longevity. We have spent the first 3 parts of this video understanding the threats, the biological mechanisms, the dietary substances, and the lifestyle patterns that put your kidneys at risk. Now, I want to shift our focus entirely to something that I believe is the most important and most hopeful part of this conversation: what you can do. The science of how food and lifestyle choices can support, protect, and even help restore kidney function is rich and growing. And it gives me tremendous optimism about what is possible for people who are willing to make informed, deliberate choices about how they live and what they eat. Let us begin with the single most powerful dietary shift you can make for your kidneys: reducing your intake of processed and packaged foods and replacing them with whole, minimally processed foods. This one change, more than any supplement, more than any specific superfood, has the most profound and consistent effect on reducing the dietary sodium, phosphate additives, excessive sugar, and inflammatory fats that burden the kidneys. I know this sounds simple, and in principle it is. But I also know that in practice it requires awareness, intention, and a willingness to rethink habits that may have been in place for decades. So let me give you some very specific, practical guidance on how to do this in a way that is realistic and sustainable. Start by reading food labels, specifically the sodium content. The American Heart Association recommends no more than 200-300 milligrams of sodium per day for most adults, and for people who already have elevated blood pressure or kidney concerns, many specialists recommend targeting 500 milligrams or less. When you are reading a label, a useful rule of thumb is to look at the percentage of daily value for sodium. Anything above 20% is considered high. Anything at 5% or below is considered low. If you start checking labels consistently, you will quickly discover which foods in your regular diet are the primary contributors to your sodium intake. And often, the culprits are not the ones you would expect. A single slice of bread might have 200 milligrams. A single serving of canned soup might have 800 milligrams. A fast food sandwich might have over 500 milligrams on its own. The numbers add up faster than most people realize. One of the most effective strategies I recommend is what I call the fresh first approach. When you are planning your meals, start with fresh or frozen whole foods, vegetables, fruits, legumes, whole grains, lean proteins, and build from there, rather than starting with packaged or processed items and trying to make them healthier. Fresh foods have naturally low sodium content. A fresh chicken breast has perhaps 70 to 80 milligrams of sodium. A fresh apple has almost none. A cup of cooked brown rice has minimal sodium. These whole foods give you the nutritional density your body needs without the sodium burden that processed versions carry. And cooking at home. Even just steaming vegetables and grilling a piece of fish gives you complete control over what goes into your food in a way that no packaged product ever can. Now let us talk about specific foods that the science suggests are particularly beneficial for kidney health. First and foremost, water. I mentioned this in the context of hydration earlier, but I want to emphasize it here because it is genuinely the most kidney-friendly substance you can put into your body. Water supports every function the kidneys perform. It dilutes waste products, it maintains blood volume and flow, it prevents the crystallization of minerals that leads to kidney stones, and it gives the kidneys the fluid environment they need to do their filtering work effectively. Many people, especially older adults, have a blunted sense of thirst. They do not feel thirsty even when they are mildly dehydrated. If you are over 60, it is especially important to drink water intentionally, even when you do not feel thirsty. Keep a water bottle with you. Set gentle reminders if that helps. And choose plain water, sparkling water, or herbal teas as your primary beverages, rather than sodas, juices, or sweetened drinks. Berries are among the most kidney-protective foods that science has identified. Blueberries, strawberries, raspberries, and cranberries are all rich in antioxidant compounds, particularly a class of compounds called anthocyanins that have been shown to reduce oxidative stress and inflammation in kidney tissue. Blueberries, in particular, are one of the foods I feel most enthusiastic about recommending for overall cellular health, and their kidney benefits are backed by solid research. They are naturally low in sodium, low in potassium compared to many other fruits, which matters for people with advanced kidney disease who need to monitor potassium, low in phosphorus, and they deliver powerful anti-inflammatory and antioxidant effects that support the health of the blood vessels throughout the body, including those that supply the kidneys. A daily serving of mixed berries, even frozen berries, which retain their nutritional value beautifully, is one of the simplest, most enjoyable additions you can make to a kidney-protective diet. Red cabbage is another food that I want to highlight because it is inexpensive, widely available, and remarkably beneficial for kidney health. Red cabbage is rich in vitamin K, vitamin C, B vitamins, and a group of anti-inflammatory compounds called glucosinolates. It is also very low in potassium and phosphorus, which makes it particularly appropriate for people who are managing kidney disease and need to limit those minerals. Studies have shown that the sulfur-containing compounds in cabbage and other cruciferous vegetables help activate the body's natural antioxidant systems. In particular, a pathway called the NARF2 pathway, which upregulates the production of endogenous antioxidant enzymes. Activating this pathway helps the kidneys defend themselves against oxidative stress more effectively. You can eat red cabbage raw in salads, saute it lightly, ferment it as sauerkraut, or add it to soups and stews. It is a versatile, affordable, and genuinely powerful food for kidney protection. Cauliflower is another cruciferous vegetable that deserves a spotlight in any kidney health conversation. It is an excellent source of vitamin C, folate, and it contains compounds called indoles that have been shown to support liver detoxification pathways, which in turn reduces the burden on the kidneys, since the liver and kidneys share responsibility for clearing waste from the body. Cauliflower is also relatively low in potassium compared to many other vegetables, which matters for people at later stages of kidney disease. And in recent years, cauliflower has become remarkably versatile in cooking, It can be steamed, roasted, mashed, riced, or even turned into pizza crusts and bread substitutes, making it easy to incorporate into virtually any diet. Garlic is one of the most well-studied functional foods on Earth, and its benefits for kidney health are significant. The active compound in garlic, allicin, has potent anti-inflammatory